This is the VOA Special English Health Report. A new study suggests that early exposure to germs strengthens the immune system. That means letting children get a little dirty might be good for their health later in life. The study involved laboratory mice. It found that adult mice raised in a germ-free environment were more likely to develop allergies, asthma, and other autoimmune disorders. There are more than 80 disorders where cells that normally defend the body instead attack tissues and organs. They include rheumatoid arthritis, which attacks the joints, Crohn's disease, an inflammatory bowel condition, and juvenile diabetes. Hay fever, a common allergy, is also an autoimmune disorder. Richard Bloomberg is a professor at Harvard Medical School in Boston, Massachusetts. He says in 1989, medical researchers sought to explain these diseases with what they called the hygiene hypothesis. They proposed that the increasing use of antibacterial soaps and other products, especially early in life, could weaken immune systems. Now, Dr. Bloomberg and a team have what they say is the first biological evidence to link early exposure to germs to stronger adult immune systems. They say this exposure could prevent the development of some autoimmune diseases. In the adult germ-free mice, they found that inflammation in the lungs and colon was caused by so-called killer T cells. These normally fight infection, but they became overactive and targeted healthy tissue, an autoimmune condition seen in asthma, and a disease called ulcerative colitis. Dr. Bloomberg says the mice raised in a normal environment did not have the same reaction. He says their immune systems had been educated by early exposure to germs. Rates of autoimmune disorders are rising worldwide, but mostly in wealthier, industrialized countries. Mr. Bloomberg says one obvious question is whether doctors should be more careful to limit antibiotic use early in life. Rob Dunn is a professor of ecology and evolutionary biology at North Carolina State University in Raleigh. He says the new study does not mean people should stop washing. In his words, wash your hands, but don't do it with antimicrobial soap. Let your kids play in a reasonable amount of dirt and get outside and get exposed to a diversity of things. The study appears in the journal Science. For VOA Special English, I'm Carolyn Presutti.
This is the VOA Special English Health Report. Watching the Olympics probably made some people feel a little guilty about not exercising. The truth is, if physical inactivity were a sport, a lot of us could give a gold medal performance. To mark the London Olympics, The Lancet, a British medical journal, published a series of papers about the problem of inactivity. Public health experts say physical inactivity is the world's fourth leading cause of death. They estimate that inactivity plays a major part in 6 to 10% of deaths from non-communicable diseases. These include conditions like heart disease, diabetes, and colon and breast cancer. Ai-Min Lee at the Harvard School of Public Health worked with a team that studied inactivity. She says the findings are conservative and may even underestimate the problem. She says physical inactivity is harmful to health, as harmful as far as deaths are concerned as smoking. The researchers compared data on physical inactivity with disease rates in 122 countries. Ai-Min Lee says researchers considered many behaviors in their study that may be associated with increased or decreased risk of disease. She says, for example, we know that if you are active, you probably smoke less. Additionally, we factored out obesity, independent of the fact that active people also tend to weigh less. Harold Cole is with the University of Texas School of Public Health. He also worked on the special report. He says physical inactivity should be recognized as a global epidemic. We have to realize that high-income countries are the most inactive around the world, he says. But low to middle-income countries are not going to be far behind as things change. He says as economies develop, people basically engineer activity out of their daily lives. Harold Cole points to campaigns that continue to reduce smoking and alcohol use. He says the time has come to target physical inactivity as a major threat to public health. He also says it is becoming clearer that our environment plays a big part in whether we exercise or not. Ai-Min Lee agrees, and she urges people to do moderately intense exercise for 150 minutes a week. Anything you can do is great, she says. Even if you don't reach that 150 minutes a week, a little is better than none, and more is better than a little. She plans to return every 4 years, just like the Olympics, to give a progress report on how the world is doing. For VOA Special English, I'm Mario Ritter.
This is the VOA Special English Health Report. Imagine this situation. You pass a group of people. The people are talking to each other. You cannot hear what they are saying. But suddenly, they start laughing. What would you think? Would you think they were laughing at something funny that one of them said? Or, be honest with yourself, would you think they were laughing at you? Yes, you. Being laughed at is a common fear, but a major study published in 2009 found that this fear is not the same around the world. It differs from culture to culture. People in Finland were the least likely to believe that people laughing in their presence were making fun of them. Less than 10% of Finns in the study said they would think that way, compared to 80% of people in Thailand. Some people in the study said they felt unsure of themselves in social situations, but hid their feelings of insecurity. Others said they avoided social situations where they had been laughed at before. The study found that people in Turkmenistan and Cambodia were more likely to be in the first group. They would hide their feelings of insecurity if they were around other people's laughter. But people in Iraq, Egypt, and Jordan were more likely to try to avoid such situations if they felt they had been laughed at before. Shy people often avoid situations that would force them into close contact with other people. They worry that something they say or do will make other people laugh at them. But some people worry much more than others. They may have a disorder called galatophobia. Gelos is a Greek word. It means laughter. Phobia means fear. This fear of laughter can be truly sad for those who live with it. It can affect how they lead their lives. In the study, a team from the University of Zurich led more than 90 researchers from around the world. They wanted to understand the difference between normal shyness and true galatophobia. Another purpose of the study was to compare the levels of fear of being laughed at in different cultures. The researchers surveyed more than 22,000 people in 42 different languages. The findings appeared in the scientific journal Humor. For VOA Special English, I'm Carolyn Presutti. Is shyness a serious problem for you or someone you know? It was for a university student who asked people in our audience for advice on how to deal with it. You can find out what they said at voaspecialenglish.com.
This is the VOA Special English Health Report. Each year, an estimated 106 million people get infected with gonorrhea. This sexually transmitted disease is getting harder and harder to treat. The World Health Organization says gonorrhea is increasingly resistant to antibiotics. The WHO warns that there are few treatment options available and that the world is running out of ways to cure it. Manjula Lusty Narasimhan is a scientist at the WHO. She explains what could happen if this bacterial disease becomes untreatable. For men and women of reproductive age, they could become infertile. For women who are pregnant, they could have ectopic pregnancies or spontaneous abortions that could increase maternal deaths. And for infants born to these women with untreated gonorrhea, over half of them develop severe eye infections which can lead to blindness. Gonorrhea is one of 4 major sexually transmitted infections that can be cured. The other 3 are chlamydial infection, syphilis, and chancroid. But the organism that causes gonococcal infections has developed resistance to almost every class of antibiotic that exists. Resistance is caused by the overuse of antibiotics and the use of poor quality antibiotics. It also results from natural genetic changes or mutations within disease organisms. The WHO says it does not know the extent of the resistance worldwide. This is because of a lack of good information in many countries and a lack of research. But it says cases of resistance to treatment are already being reported in several countries. These include Australia, France, Japan, Norway, Sweden, and Britain. The WHO is calling for smarter use of antibiotics and more research into new ways to treat the infections. Dr. Lusty Narasimhan says there is no current research into new drug treatments for gonorrhea. She says, "We have no plan B right now." She says curing the disease is no longer as simple as taking a pill. As she puts it, we are in a state right now where in so many places this organism is rapidly developing resistance. So we do need to start looking into the research. The WHO is calling for urgent action to prevent the spread of untreatable gonorrhea. A new global action plan calls for increased monitoring and reporting of resistant strains of the disease. The plan also calls for better efforts to prevent, diagnose, and control the infections. For VOA Special English, I'm Alex Villarreal. You can find links to more information about gonorrhea at voaspecialenglish.com.